Hi, my name is Brittany Johnstone, and I'm going to show you an effective way to muzzle a dog. Generally, you muzzle a dog because they're uncooperative or they're nervous biters. You want to make sure, first off, that you get the correct muzzle size. You want to get one that's loose, loose enough so that the tongue color can be observed after it is on the patient. Ideally, if your patient is panting, you want to get a basket muzzle for something like that, as to not restrict the breathing. If you have a brachycephalic dog or any guy with a short muzzle, a gauze muzzle might be a good way to go. But they really aren't ideal because you can't monitor the tongue color, and sometimes the patient can even remove them. After choosing the correct muzzle size, you want to loosen it all the way so when you get it around the patient, it's not too tight, and you won't risk the patient pushing it off before you're able to loosen it. You want to come at the patient, generally from behind, so they can't see you. There is a short and a long part of this muzzle. I want this top part, or the short part, to be on top, and I kind of want to go in a scooping motion around the patient, quickly grab this, secure it, and then I'm going to tighten it. So the patient's looking at me, but generally you want to come at it from behind, do the scooping motion around, quickly snap it together, and then tighten it right behind the ears here, super tight. You want to fit about one finger in there, but no more than that, and that's how you effectively muzzle the dog. Okay, next I'm going to demonstrate to you how to properly use effectively a restraint pole, excuse me. First, you want to take the pole and make sure that it's functioning correctly. You'd hate to get into the situation and have it not work correctly, lose your window, and then the pet catches onto you or otherwise gets away. All right, so I'm going to approach the patient, not making any eye contact, slowly as to not scare or startle him. Going to put this around his neck, going to tighten it. Pretty tight, but not too tight. Ideally, you would like a finger's length width in front of you, in the loop, but obviously you can't test that. So then you're going, in order to walk with the patient, ideally you want them to walk either beside you or in front of you. Again, keeping your safe distance and a good firm grip on the pole. And then to loosen the patient, I'm going to again release that control knob, slip it off, and then back away.
All right, next I'm going to try and demonstrate here how to properly restrain a cat using a towel, making otherwise known as cat burrito. Place the patient on the towel, having all hands around. Going to fold what little, it's kind of a larger cat, so I don't have a lot of area here, but what I would do is fold this back end over. That keeps them from escaping backwards as well as forwards here. I'm going to take the left side, keeping the head exposed, curling it around the patient, tucking it under, but not all the way. Taking the other side here, tucking it over tightly here. And again, leaving the head exposed, making a little cute cat burrito here. That allows us to put the patient in lateral recumbency, kind of take a paw out as needed to do what we need to do. All right, next I'm going to demonstrate how to obtain a urine sample with a urinary catheter in a male dog. So I shave the prepuce hairs off and kind of create a little bit more of a sterile feel, as sterile as it can get. And then after this, I'm going to rinse twice with like a warm antimicrobial solution, and then I'm going to dry it. So I'm going to use some Chlorhex wipes. That area all shaved. I have some Chlorhex wipes here. Put on some other gloves.
Hey, Brittany, don't worry about it. If it's a small thing, I can do it.
Rinse it here with some water.
Go ahead.
We'll do this twice.
Oh, okay.
Rinse again. And then I'm going to go ahead and flush the penis with some dilute Chlorhex.
Twice.
Then I'm going to go ahead and apply my gloves here to make it a little bit more sterile, some sterile gloves. I have my polypropylene catheter here. What I'm going to do is I've cut, if you can see, a little notch here. This is going to help me keep it just a little bit more sterile as I advance it into the urethra here. I'm going to put some sterile lube on the end of it, and I'm going to have my assistant here, Dr. Davis, help extrude the penis, helping to advance it. I'm going to dab it dry here a bit. Once I get it in, I'm going to be sure and dispense the first couple milliliters just to avoid any contamination. And then, all right, next I'm going to have Dr. Davis here extrude the penis and apply some lube to the end. I'm going to go ahead and advance it into your here. There may be, you never want to force it too much. There may be some resistance right at the os penis, but you don't want to ever force it too much. I'm going to hook the syringe here at the end. Go back. And I do get some urine here, so I'm going to discard this first couple milliliters.
Oh.
Attach it again.
60.
And then continue with my sample. When I'm done, so now I'm hitting some resistance, so I'm not easily able to pull back, so I'm going to just go ahead and stop. I'm going to attach my syringe here. I'm going to go ahead and pull out. Slowly. And that's it.
Good job.
All right, next I'm going to show you how we do a sterile, a urine catch, a free catch, otherwise known as a void catch. What I'm going to grab first is just a 3 cc syringe, because you don't need a whole lot without the needle here. We keep our, we kind of catch them in what are these ladles here at work. And we keep them wrapped like so, and we autoclave them after each use. So I'm going to take one that I've already opened here. We're going to go out. What I'm going to be careful in doing is right as the patient urinates, I'm going to wait about a second or two to let him urinate, and then I'm going to start catching the urine. This just kind of, I'm going to walk behind the patient with this, have my ladle ready. This is a male dog, so hopefully see how he urinates. 1, 2, and I'm going to start catching the rest. Okay, so I got a little bit in here. I'm going to grab my syringe here, suck it up here in the spoon, and just empty out the rest. And then I'm going to go put this in a container. Read this straight. How to do a cystocentesis drawing. We're going to get a sterile urine sample from this kitty using an ultrasound. Wet the area with alcohol. Then we're going to use a needle. Kind of go into a 45-degree angle in the cranial portion. Try going region of the bladder. You did it. Alright. That's all she's got. Perfect. Alright. Thanks. Alright. Okay. Next I'm going to demonstrate how to express anal glands on a canine patient here. I have so first what I'm going to do is lift the patient's tail. I have gloves on. Going to dip my forefinger here in the sterile loop. So each sac opens at like the rectal anal junction, just adjacent to the location of where the sac is actually located. So like you were thinking, if you were looking at a clock, it's at like the 5 and 7 o'clock location. So I'm going to stick my finger inside the patient's anus here, and then I'm basically going to milk it out, just gently squeezing. This material really depends on how well the patient is expressing its anal glands. If it's thick, that generally means the patient is not expressing them as well. If there's any blood in it, that can indicate infection. You might even need sedation to do this if they're impacted. So what I do right now is I have my forefinger and my thumb kind of right around at the end of the anal gland here at the 7 o'clock position, and I'm just going to gently squeeze and pull it out onto my gossamer. So this is normal material, dark brown, but easy to express. So that looks all normal. I'm going to go into the other side here, grab some gauze squares and have that ready. Again, this is the 5 o'clock position. Just going to move, kind of gently milk it out so it exits. This is easy to express. Again, same type of material, normal material, kind of that lighter brown. Then, next I'm going to show you how we do a nail trim on a canine patient. The first thing that you want to note when doing it is have the patient obviously held by a technician, well muzzled if need be. Then you're going to lift the paw backwards. The main thing you want to look out for, this guy's got clear nails, so that's good, is the quick. The quick is the part that you do not want to hit. So you'll see a clear part and a pink part on the nail. You want to stay away from the pink part. And you also want to do little bits at a time, because sometimes the quick can be deceiving, or you think it's farther down, but it's actually more towards the distal part of the nail. The other things that you want to have ready to go, of course, your nail trimmers. You want to have your silver nitrate sticks, really kind of as a preference, whichever one. I prefer to use the Quick Stop septic powder instead of nitrate sticks. I think it just burns less and it just stops the bleeding quicker. So I'm going to have some of that ready, just in case that I need it. If I do, what I'm going to do is dip the patient's nail in it if it starts to bleed, and it should help cauterize the end. So first, like I said, what I'm going to do is take the patient's foot, lift it backwards like so. Generally, when you cut the nail, you want it to kind of be right in the direction of like right even with the paw pad. That's generally speaking how short it needs to be. But like I said, I'm going to do little bits at a time as to not lose the trust of the patient. So just a little bit. Okay. So that's generally how I would do the front part of the nail. Back, do the same thing, lift up, facing this way. You kind of want to do it at an angled version, again towards the paw pad here, just getting the tip. So I generally allow the patient to kind of put his paw down as needed, as to not cause him to radically behave and freak out. Alright, so that's
Alright, next I'm going to demonstrate how to do a proper cat nail trim. So I got my assistant here holding. I have Quick Stop if needed. What I'm going to do is do one paw at a time here. Ideally, if the patient is uncooperative, you can put them in lateral, but she's a pretty good kitty. So I'm going to grab one paw at a time and kind of gently press on each toe digit here, and that's going to allow the nail to stick out here, and I'm going to cut it just up to the pink part, which is the quick. Yes, you are doing so well. Alright. So yep, just all 5 here. Again, just getting right up to this pink part here. Don't want to go any farther past that. And I'll just do one back foot and then I'm done. Doing great, huh? So again, squeezing it. And that's it. Thanks much.
Alright, next I'm going to demonstrate to you how we would pill a canine patient. So what I'm going to do is, I use a little bit of a pill pocket here. Sorry, this guy's a chronic heart failure dog, so we got coughing going on. I'm going to put the pill inside a small piece of a pill pocket here. What that does is, first of all, the taste, and it kind of helps me to grip it better and get it down into the patient easier. What I'm going to do first, tilt the patient's head back, lower the jaw, raise the upper jaw, place it on the base of the tongue, as far back as I can get it. Close the patient's mouth and try to get him to swallow. So what I'm going to do first here is lift the patient's jaw open, and then top jaw, put it all the way back in the base of the tongue. Close his mouth to try to induce swallowing. And he's licking his nose, you see, so that means he's swallowed it. So, if you're talking about a medication like doxycycline or something like that, generally that can be, it takes a long time to travel down the esophagus and into the stomach and can actually cause some damage to the lining. So you would want to follow it up with some water, which I have here, to swallow, so that makes the pill move faster into the stomach as to not cause damage to the esophageal lining. All right, thanks so much. All right, next I'm going to demonstrate how to properly pill a feline patient. What I'm going to do is take her top jaw with my 2 fingers here, tilt her head back, place the pill on the base of the tongue in the back, and then induce the patient to swallow. And I'm going to use my right hand to pull the bottom jaw down, base of the tongue, keeping the mouth shut. Going to rub trachea here, try to get the patient to swallow. There we go. And it's in. I'm going to show you how to properly clean and medicate a canine patient's ear. So I have a kind of some generalized ear cleaner. It has moisturizing agent in it as well as salicylic acid to help dry out the ear. First, what I'm going to do is pour just a small amount into the patient's ears. And then I'm going to massage right here at the base, and you'll hear a squishy sound, and allow the patient to shake his head. That gets out any excess ear, gunk, and clean it out. Kind of, he does the job for me, more or less. So I'm gonna go ahead and pour some into the patient's ear. Do a good squeeze. Massage right here at the base. Allow him to shake his head. Perfect. I'm going to obviously tell the owners if they're doing this at home to do it outside or in the bathtub. Do some of this ear. Massage right at the base. Perfect. Allow them to shake. And then I'm going to also apply some here to my gauze squares and kind of just do a swooping action and get just as far as what my finger will reach. So, swooping action. It's got a little bit of gunk. Not a whole lot in this patient's ear, so then kind of work on the outside of the ear. So right ear looks good. To the left. Good job. A little bit more in that one.
Gross.
Perfect. So again, just allowing my finger to kind of go into swirling action around the ear. To the outside of the ear, and like I said, if I needed Q-tips, if some dogs have a lot of folds in their ears, and so that's when I would use this to kind of clean inside the folds. Again, never going inside too deep with the ear with these. All right, next we're going to put some medication in it. You want to, with this particular medication, you want to shake it really well because it can all sit at the bottom, so you want to mix it around, and it's thicker. So then at the end, I'm going to give it a good shake so it all falls down here. And then I have the cap off, so what I'm going to do is put it in the patient's ear just as far as where I can't see the tip of this, and then give it a good squeeze. Good squeeze. Massage right here at the base, so it falls down. The patient shakes his head, it's okay. The medication's thick, so it should be making its way down the ear canal. Perfect. Good job. Alright, next I'm going to demonstrate to you how to properly clean and medicate a feline patient's ear. So again, I have our general ear cleansing solution here with aloe vera and salicylic acid. Unlike the canine patient, I'm not going to pour any into this patient's ear. That can actually cause some damage to the eardrum. So what I'm going to do is go ahead and soak my gauze squares here with some of the cleaning fluid and then do a good swiping action with my forefinger. It's just as far as my finger will allow me to go in. So I'm pulling back on this patient's ear. Swipe. Got some debris there. There's some silent bone. Pulling back the patient's ear, doing a good swipe. Again, just as far as my finger will allow me to go. I'm going to keep doing this until there's no more, until my gauze squares have no more debris on them. You got some jerk ears. Turn them on down. Alright, so we'll swipe. Patient's left ear here. This ear is not nearly as bad as the right, so I don't think I'll need as much. Yes,
So I'm not getting any more on my Cosmore. So that knows that it's clean, good to go. Like I said, you can, I would never advise the owner, but you can use some Q-tips to get some inside the folds here, because cats are known to have a lot of those. But no. I'm going to medicate the cat with the Tresiderm, some ear medication here. So I'm going to go ahead and pull back the patient's ear, stick the tip of it into the patient's ear to where I can't see it anymore. Give it a good squeeze. And rub it, kind of massage here at the base of the ear. You'll hear a squishy sound. And then I'll go ahead and do the patient's left ear. So again, squishy sound. Yeah, that's it.
Okay. All right, next I'm going to show you how we properly clip and clean, prepare a wound. So of course I've got gloves on, I have clippers, and I have some chlorhexidine soaked gauze sponges here. So first I'm going to shave the area all around, leaving and including around the wound itself. Now that it's all shaved, I'm going to take my chlorhex soaked sponges here, good scrub. This is a little antiseptic solution. That I finished clipping, cleaning the wound. The next thing I'm going to do is add some Piercing topical ointment to it. Some on the glove, again wearing gloves. And after it's clean,
I ran out of paint yesterday. I've just got
just
those
want to
3
apply it
windows.
to the wound, kind of a circular motion. In this case, the patient's going to be wearing an e-collar, so it can't get to the ointment.
All right, next I'm going to demonstrate to you how to insert an esophageal lead as basically for an esophageal stethoscope. So first I have some sterile lube here. I'm going to go ahead and lube all around here. I have it hooked up here. So what I'm going to do is just advance it into the esophagus, which is just below the trachea here. And I'm going to just measure from the apex of the heart right about to the nose. So it's going to be almost the length of this whole thing. So, but what I'm going to do is do it by listen here. So I'm going to go ahead and hook these up to ears. So I'm starting to hear the heartbeat. It's getting pretty loud. So now it's a little softer, so I'm going to pull out ever so slightly. There. So now I know I'm in. You can hear the heartbeat's pretty good. Okay, thanks so much. Okay, next I'm going to perform 3 ocular eye tests on a canine patient, but first I kind of wanted to show you everything as far as setup goes, so I don't have to fidget around with the patient and kind of lose my window. The first thing that we're going to be doing is doing an ocular eye pressure check. So of course I have my tono pen here. I'm going to show you how we calibrate it here in just a second. Calibration goes with this tono pen here. I'm going to go ahead and take my tip cover out of the package. I'm going to go ahead and place my tip onto my tono pen. Such. We're going to be pointing the transducer straight down. I'm going to depress that operator's button twice rapidly. It's going to display cow, which is what it's doing. I'm going to wait about 15 seconds. And once it beeps, I'm going to point it straight up, like I said. Up. It says up. Now we're going to wait. And it says good. So we're ready to go. I'm going to go grab the patient and we're going to get started. All right, next I'm going to demonstrate how to do ocular pressure check. So I already calibrated my pen in the last video. So it said it was good to go. Well, yep, okay. So I'm going to hit right in the center of the cornea here. I already put proparacaine in this patient's eye. That's to help numb it. And I'm going to hit right in the center of the eye on the cornea here. If you let me. And I'm going to continually keep pressing on it until it beeps.
Seriously.
Okay. So you want it to be between 15 and 25. We're going to get 3 readings on each eye. But I'm just going to do one eye for the sake of time here. All right, and get one more. Okay. You're silly. Main thing you also want to be aware of is when whoever's holding your patient that they're not squeezing the neck, which she's not doing, because that can affect your readings. So yep, again, all between 15 and 25, so we're good to go with that. So then we move on to the tear test. Inside the packet here, you can see that there's these two blue lines. I'm going to go ahead and pre-fold these right along this blue line. That just keeps my fingers from the oil and everything on my hands from affecting the test strip. Again, you're going to want to, what I'm going to do is fold down the lower lid in the patient's eye and place the fold right inside the lower eyelid here. And it's there's one for each eye, left and right. And again, for the sake of time, I'm just going to do one. And you want to keep it in there for a minute. And again, you want the reading, just like your eye pressures, to be between 15 and 25. Avoiding touching that end that's bent. Patient's right eye. And lower that eyelid and place it right in there. So you're going to allow the patient to blink for a minute here. Again, you want it to be between 15 and 25, means that the patient's producing a normal amount of tear production, so it doesn't have dry eye. It's going pretty rapidly. We're almost at the 15. Yeah, he's good. 5 more seconds, and it's almost at the 20 here. I think it's at the 18. Okay, so it's about 18. So we're normal. We're good. So we're going to go ahead and pull that out. As you can see there, the dye is right at the 18, 19. So patient's great as far as that's concerned. Do the same thing in the left eye with the other strip. Okay, last thing we're going to do is check to see if there's any corneal ulcers. So like I said, I pre-made the syringe here with that ophthalmic strip with the fluorescein stain in it. And I'm going to go ahead and just put a couple drops into each eye. Rinse it out with some eye wash, and then use my Woods lamp to see, and that should, if there is any ulcers, it would pick up the dye and let me know. So I'm going to just put a couple drops. I know, honey. Okay. Okay. And I got some wash here. I'm just going to rinse out the excess. You're doing so good. It's like you people. So now I'm going to take my Woods lamp here. Turn it on. And check. No stain uptake in that right eye. And none in that left. So patient's good to go as far as all that goes. All right. Okay, next I'm going to demonstrate how to do an enema. This patient actually does not need an enema, so I'm just going to kind of basically perform what I would be doing if it did. So I have a bowl here of some warm water, and I put some, ahead of time, some sterile lube or some lube in here, and I'm going to kind of make like a 50-50 mixture. The two. Mix up, real good. Then I have a 60 ml syringe here, and I have, and then I'm going to use just one of these red rubber catheters to insert that up the patient's rectum, because I can easily attach my syringe here to the bottom. So first thing I'm going to do is draw up the solution here into my syringe here to start out with. Really, the amount depends on the patient, the size, how much the doctor instructs you to do. I'm going to grab my catheter here. And I have some lube packet, in which I'm going to put some lube at the end of it. I'm going to use my finger, I'm going to put some lube on my finger, and I'm going to direct the catheter tip here into the rectum. So kind of guiding it through there, so I know which direction it is going into the colon. Touch it.
like you have boys and I did.
I think you love that one. I had right a couple weeks ago. So I think about like these people that
I don't want to force anything. That includes this and the fluids.
Yeah.
Said if this patient actually did need an enema, I would just slowly be pushing in here on the syringe, guiding the fluid through the catheter up in the patient, and then slowly, I generally squeeze off the tip here at the end, and then I'll slowly pull out, and then allow the contents to go.
Okay. All right, next I'm going to demonstrate how we perform subcutaneous fluids on a dog. What I got here is a bag of lactated Ringer solution with a line hooked up to it and a needle at the end. The needle size really just depends on the patient. Generally for a feline patient, I would do a 20 gauge needle or like for a small puppy. For this guy, I'm going to do an 18 gauge needle. Just helps us get it in a little quicker. What I'm going to do though is the ideal place to put subcutaneous fluids is generally right here at the neck of the dog where there's a lot of loose connective tissue here. Lifting the patient's skin to make that tent, and I'm kind of going caudal, cranial into there, and stick it in. Have my technician help hold the line in because this patient will move. Then I'm going to undo the IV line. I'm going to hold it high into the air as to let gravity help out, and it's dripping in to the patient. The doctor will assign you how much fluids to give kind of based on the patient's needs, dehydration status, body weight, that kind of thing. So after you get to that point, cut off fluids, and again, monitoring that pocket to make sure it's not getting too tight. Pull the needle. I'm going to lift the tent up again, pull the needle out, monitor for any signs of bleeding, anything like that. You really shouldn't have any blood coming out. Generally, I'll kind of just put my finger right at the spot, so if there is any bleeding, to help start the clotting process, and then I let go and cap back the needle. And then that's the end. Thanks much. All right, next I'm going to demonstrate, trying to get my head in the picture, how to do a modified Robert Jones bandage. What to do is make the stirrup here. This is always the tricky part. Yeah. See? Getting the tape to stick. So what this does is prevents the bandage from slipping down. But I have the stirrups in place here. I'm going to go ahead and start with my primary layer here. I'm going to remember to leave some of these toes exposed. That allows us to see if there's any swelling going on. That allows easy access to see that. So.
Actually, was that Marley Mays?
I don't know, reset it for
So
5
again,
minutes.
distal to proximal.
Honestly.
I'm going to overlap by
Yes.
50%.
So we're ready to go. And once we get the blood sample.
And I want to try to make it as smooth as possible when doing so.
5 minutes. 5 minutes. I know he's gonna pick up with you.
I didn't do lunch yesterday.
So I'm going to tear this off. Now I'm going to work on my secondary layer, which is my stretch gauze here.
I knew that I thought it would happen. About 20 minutes into the damn.
So this part's going to be a little bit tighter, but not too tight. And again, I'm overlapping by 50% distal to proximal. And then next, I'm going to work on my tertiary layer, which is the vet wrap. Oh, actually, sorry. First, I'm going to take off my stirrups here. Twist them attach that firmly to that gauze layer.
Of course, tape always sticks when you don't want it to, and then it doesn't stick when you want it to. So this is
Gonna keep the bandage from slipping down. Alright, now my tertiary layer here. Again, overlapping 50%. It's going to be a little tighter too, but not too tight. I'm going to actually unwrap some of this to release some of that tension. Leaving some of that cast padding there, about a ½ inch. Clear that off. You can add some elasticon at the bottom just for further protection. That's what I'm going to do. So I'm going to touch that at the bottom again, leaving the toes exposed.
We're doing
Okay.
300 bolus on this one over 3 minutes.
As you can see, that's how you do a proper. Okay, next I'm going to demonstrate how to properly remove the bandage. So first I'm going to remove this elasticon because I made a tab on it, so that's easily removable. And then next I'm going to take my Lister, my bandage scissors, my Lister bandage scissors, and I'm going to begin cutting layer by layer here.
Somebody else. A cat that needs blood, I think.
Doing just little bits at a time. Again, layer by layer. And then next, I'm going to do gauze over here.
This one, she would like a CBC is all for right now. We just got one in case people need it. I mean, not as, yes.
Every hour is blood and urine on everybody.
Yes, exactly. Every week's blood and urine, 3 hours.
Stirrups. Properly. Okay, next I'm going to demonstrate how to do a modified Robert Jones bandage, but this time I'm going to add a splint. So first, just like the last one, I'm going to go ahead and add the stirrups. Just keep the bandage up or secure in place. Alright, so next I'm going to add the cast padding layer. In this case, I'm going to do a whole lot. The doctor instructed me to do a lot since our splint here is pretty thick. So again, I'm going to leave some of the toe exposed, so I'm going to go distal to proximal. I'm going to overlap by about 50%. First layer here is not going to be as tight, but it will get tighter as I progressively get thicker. You don't want to cause any, pressure necrosis by making it too tight. And again, you want to make sure the id is as flat as possible, because that could also cause some pressure issues. Tear off, and then I'm going to put more on there though. Again, I'm going to follow the distal to proximal route here. Actually, pretty good. All right, cool. So now that fits the size of the cast pretty well, I'm going to go ahead and move on to my next layer here, which is this stretch gauze. Again, I'm going to make it as flat as possible. This I can afford to do a lot tighter because I have several layers of cast padding here underneath. Next, I'm going to take my stirrups here and go ahead and attach those. Do a twist and kind of do a pull up. Okay. All right. And then next, I'm going to fit my splint here and then take my final layer of vet wrap and wrap that around there pretty tight. And I'm going to get the bottom at the very end, okay? Again, distal to proximal,
to be much tighter this time. Again, all my layers underneath are allowing this layer to be tighter because it, ideally you want to leave just a little bit of that cast padding showing right down there at the end. Cut a piece of some elastic on here, and I can coat the bottom, cover the bottom and top depending on what the doctor wants. Okay. All right, and that's pretty much it. Thank you. Okay, what do you want to change? And next, I'm going to demonstrate to you how I would remove the bandage. So I'm going to do one layer at a time, kind of going along the lateral edge of this bandage. Again, just small amounts at a time. Now I got that layer removed. On the other layers. Again, kind of focusing on the lateral aspect of this leg. Just doing small layers at a time, just to not obviously cut the patient's hair, cut the patient's skin. Remove your straps. That's about it. Okay, all right, next I'm going to demonstrate how to do an abdominal kind of emergency pressure bandage. Got my materials here, including a Telfa pad. That's going to help stop the bleeding. So first I'm going to get that out. I'm going to apply it as if any patient had an open wound right here. Then I'm going to take the cast padding here, kind of quickly go around. This helps so my vet wrap or whatever you choose to use, which in this case I'm using different material, isn't too tight. You're good, buddy. You're doing so well. What's the matter, Brittany? I want to film it.
She's filming.
And then, after getting that done, I'm going to go to my next layer here. Again, this layer you want to be tighter because you want it to get stopped bleeding. Oops.
Excuse me.
This one again is tighter. You want it tight, but you want to be able to stick just about one finger. Like you can see, it's pretty tight. I can stick just about one finger underneath there. All right, next I'm going to perform an emergency assessment on a patient coming in. Obviously, you want to get as much information as you can on the phone from the owner. That gives you the luxury of setting up your stuff ahead of time, like your catheter size or your ET tube size, things like that, based on the patient's size. If you can't, your initial assessment comes right when they come back through the door. You want to see, are they walking, are they being carried? That'll tell you a lot already. Then you want to move obviously onto their respiratory rate. Is there an effort behind it? Is there some kind of pattern behind it? Whereas in this case, this patient is not coming in for an emergency. Her respiratory rate is kind of nice and slow. There isn't a lot of effort behind it. If there is, that could indicate things like thoracic trauma, pain, stress, laryngeal paralysis, foreign body, which in that case we would need, you can't see here, but I have a little emergency E-tank. That would mean you might need some supplemental oxygen on the patient or placement of an endotracheal tube. Then you want to get your hands on the patient. You want to check the mucous membrane color, quickly lifting up the lip here. This looks like a nice kind of light pink. If it is blue, that means we're short of oxygen in the blood, so we want to get oxygen, supplemental oxygen on the patient immediately. If it's a dark red, that isn't necessarily a good thing. That could mean carbon monoxide poisoning. That could mean heat stroke. If we're yellow, that means obviously icteric, liver issues, but that's something we can put on the back burner, address later. If they're white, this is where having information from the owner is a good thing. That obviously means we're anemic, but have we been that way for a while? Are we dealing with a prolonged flea infestation? Or is this a more short-term thing? We're just noticing it. That can mean things like the heart is not pumping blood adequately. It could mean that we're vasoconstrictive due to some kind of shock. Then you want to get your stethoscope out here and listen to the lungs. You're going to listen on both sides. You're going to listen for things. Are they harsh? Are they quiet? If they're harsh, that could mean things like pleural effusion. If they're quiet, that could mean things like pleural effusion. If they're harsh, that could mean things like pulmonary edema. You want to listen on both sides. That could let you know if it's louder on one side versus the other. Do we have some kind of diaphragmatic hernia going on? So I'm going to go ahead and listen to the patient's lungs. Nothing to note on the right side. We're not panting or anything, so everything's great. Nothing to note on the left, no unusual sounds. Then of course, while you have your stethoscope out, you want to listen to the heart. Or you can get it by digital palpitation as well. Are we tachycardiac? Which in this case, this patient's a little stressed out, so her heart rate, let's see. Her heart rate's right at about, like 210. So she's pretty stressed out, but if it's tachycardic, that could mean things like pain, that we're having, we're in fear, we're in some kind of shock. If it's bradycardic, that means we maybe have some arrhythmia going on or urethral obstruction. Then of course you want to listen to the pulse quality while you're doing that. Is it nice and strong or is it super weak? If it's super weak, we could be dealing with things like we're hypotensive. If you, after that, if you have the luxury here, you want to, you can get a quick assessment actually of the mean arterial blood pressure by checking pedal pulse. Putting your thumb and forefinger right here on the patient's foot. If you could feel it, that means that the mean is 80. If you can't feel that, then you move on to your femoral pulse inside the leg. That lets you know that the mean is 60. So I'm going to move on, excuse me, to your capillary refill time. That lets you know, is the patient need to be on IV fluids right away. Some supportive care as far as that goes. If it's short, that means we probably have some sepsis going on, meaning less than 2 seconds. If it's prolonged, again, that means that we need IV fluids right away, which in this case, it's about 1.5 seconds, so I'm not at all concerned. Then you want to address the is there any external injuries on this patient? Any obvious wounds, and address that as need be. And then mentation of the patient, check the patient's pupil size. A lot of times you can get that upon coming back into treatment. Are they large, are they small, are they responding to light? In a dog, if they're large, that could indicate things like a irreversible big brain lesion, but in a cat that generally is in shock, they have large pupils, so that doesn't necessarily mean that we have any brain issues going on, so that's something you need to keep in mind. Also, is it responding to light in the environment? That tells us a lot of neurologic things. Then you want to look at their posture. Are they hunched over? Are they lifting an arm? That could indicate things like neck pain, back pain, obviously any broken wounds, also various neurological issues.
All right, next I'm going to demonstrate how to clean and properly flush a laceration. In this case, this girl's got it on her lateral torso here. So I got my clippers. I have my crystalloid fluid. You can really use LRS or sodium chloride, 0.9%. I'm going to use sodium chloride here. You can add an antiseptic to it. Make sure it's the proper dilution, like Chlorhex or betadine, things like that. In this case, we're not doing any of that. I have a 35 ml syringe attached to my 3-way stopcock. Again, attached to the line to my flush. I have some sterile lube, which I'm going to use, and I'm also going to use the end of the catheter tip. That's going to help me get inside the wound and properly flush it out. And then I also have some gauze squares soaked with Chlorhex. So the first thing I'm going to do is apply some lube to the wound here. That helps me, so when I'm clipping, you can see it's already clipped a little bit, but it needs a little more. That helps me so when I'm shaving the hair, that it's not getting into the wound as I'm shaving, causing further infection. So I got gloves on. So I'm going to go ahead and apply some of that to both. There's 2 puncture wounds here. I'm going to go ahead and start shaving. So now that I'm done shaving, I'm going to grab my Chlorhex squares, gauze here, and I'm gonna disinfect around the wound here with Chlorhex. It's disinfected with the Chlorhex. Now I'm going to take my catheter tip here. I'm going to just use an 18 gauge because that's the largest that we have here, and attach it to the end of my stopcock, and that's going to kind of act as like a little irrigation to help me flush. And I'm going to fill my syringe by and then I'm going to start flushing. What I'm going to do is stick the end of this catheter tip in all the pockets inside the wound here and give a good flush. So trying to get all the dead space underneath the circular space here. So that's pretty much how to flush a wound, and we're just going to continue to do this off camera.
All right, next I'm going to demonstrate to you how we do kind of a general dental prophylaxis, like dental cleaning per se. So first what I'm going to do is assess the patient's mouth. Obviously I can see here that there's a lot of gingival hyperplasia involved, but first what I'm going to do, what we do here is we take some of this dental Chlorhex rinse and kind of just rinse it down. Oh, it might not be opened.
Yeah, that's a new one, sorry.
That's okay. And kind of just do like a general rinse of it. And then next I'm going to take my ultrasonic scaler here. Again, like I said, I'm going to focus on just the flat end here, and not staying on more than one tooth at a time for more than about 2 to 3 seconds, no longer than that. So I'm just going to do, for the sake of time, just a couple teeth, the ones that have the more tartar on them, like these guys and our canines, things like that. And again, proper adjustment. So 1, 2, 3. So I'm going to focus on getting underneath the gum line here, also while I'm doing it. But like I said, I do have another tip here that is designed to go underneath the gum line. Kind of going back and forth between these two teeth again, because you don't want to stay on a tooth for too long. Another good idea, instead of using this, like I said, I can do some hand scaling. Like I said, we have 2 different types here as far as hand scalers go. This one has like a sharp edge, so I'm going to make sure and not go underneath the gum line with this, because that can actually cause some damage. So I'm just going to grab it here, kind of scale right along this flat surface here with the tooth. If there were any extra sharp, I can use, like I said, I can use a hand scaler to do that. But again, I'm not going to go under the gum line with this. Instead, later, I'm going to switch my tip on my scaler here and adjust again my power so it's not, it's lower, so I can go underneath the gum line. But again, that's again how I would hand scale. If I needed to get tartar off, I could use, at the very beginning, I could use these the tartar crackers like such. So that saves some time with anesthesia, of course. We have a pretty good dental machine with different tips that can do this, so I don't necessarily have to use my hand tartar crackers. And then next, so after I'm going to use this tooth again as an example, I would take my probe here, and it's really hard to see, but there are little notches on here, and again, I want something under 3 millimeters. That's normal. There's a lot of gingival hyperplasia in this dog, so I have to keep that in mind too when doing this. And fortunately, it is right at the 3 centimeter mark. What I'm going to do is kind of go up and down, not dragging it, but going all around the tooth here. And it's all under 3 millimeters, fortunately. And I would do that to every single tooth here that I can see. So this is the 200s and the 300s. And then I would also do the palatal aspects here of the 100s and 400s. That applies with the cleaning and of course the probing here. And so go ahead and go. All right. Again, just for the sake of time, I haven't done this whole side, but I'm going to demonstrate to you how we would polish. So after I've cleaned this tooth thoroughly underneath the gum line and all around the aspects here, the 204 here that I can see, we have some polish in our polisher here, and I'm just going to scoop some out, and then I'm going to kind of go in a circular motion, also trying to get underneath the gum line up in here. I'll show you how I do that. Again, pressing down on the pedal, circular motion. You don't. That's how I would do the polish. And then next, if after I'm done with that, I would rinse the tooth. And then after the dental cleaning itself, if we had a fluoride treatment, our polish has fluoride in it. But if we did not, I would use something like the CET Fluorofoam. That what I would do is rub it on the tooth, let it sit on the tooth for about 1 to 3 minutes, and then wipe it off. Not rinse it off, but wipe it off with a towel. So that's it.
Alright, next I'm going to talk to you about at-home dental care. It's really important to educate your clients at starting this at a young age. You know, you want to send the client home with your toothpaste, and it's an enzymatic toothpaste made especially for dogs and cats. Don't want to use human toothpaste. That can really irritate their stomach. Of course, some of them have xylitol in it. Don't want that either. So important parts as far as brushing their teeth is you want to start out with the areas that build up the most plaque the quickest. That can really vary per patient. So generally speaking, though, it's these back, caudal teeth, molars here. You want to have the client go in at a 45-degree angle, kind of focusing on this, obviously the surface of the tooth and into that sulcus along the gingival line. And then you want to move to, you want to do that for about 5 to 10 seconds before moving to a different part of the mouth. Rinse with kind of a chlorhexidine rinse. That kind of helps with the prevention of tooth and gum disease. So ideally, you would like to use that. We also like to send clients home. Oftentimes at a young age, kind of get them started is using Hill's makes a wonderful diet called TB. It's kind of what's known as tooth diet. So how it works is how they bite into it, helps break down tartar buildup, things like that. A lot of our clients also have Hill's makes dental chews, or you can do like CET chews, which are kind of like more rawhide-like, that have kind of an enzymatic coat on it. What the focus of these are is more or less moving saliva around the mouth, keeping from tartar from building up and staying, in one place. Or this, and yeah, that's pretty much it. Thanks so much.